Hi, this is Brian Warmers. I'm recording a lecture for NUR447. This is going to be a review of the clinical component of this course. So starting off, underneath this tab, we get clinical schedule, and we'll review that quickly. So hopefully you've received this already, you've been through it, and don't have any complications with this. But just to go through, find your name and look at the group that you're in. So this group is Avera from 6:30 to 4:30. This is Avera from 2 until 10, and so vice versa for Sanford and for Sanford down here for evening. And so as you work your way across, you're going to notice some things. Simulation. Simulation is 4 hours in length. It is in our sim lab up in Jeske. I'm guessing that you've been there before. There is prep work that you need to have done prior to this, which will help you out tremendously in your simulation. Realize that there is 4 hours allocated for time, but you will have to do a couple of hours for prep work before and after. And so you do get credit for 8 hours of clinical time for sim. Otherwise, you will be having floor experiences. You get 4 experiences on the floor at either Sanford or Rivera with your instructor, who could be Ashton, Laura, Allie, or Jordan. And then you will have a Health Connect fair, and we'll talk about that in a little bit. The red boxes are the days that you'll present your teaching plan, and we'll talk about that in a little bit. And then on October 6th and October 7th, there's an child abuse conference. While it's not the feel-good event of the semester, it is a very rough topic, but it is something that we as nurses that deal with pediatrics, whether that's through the emergency department or in other environments, we need to be able to deal with. So child abuse is a key component of this course and learning to identify and what do we do with that. So having you go to this conference, which is just amazing. You'll see many of your clinical instructors go to these conferences. So while when you leave there, you're not feeling so good about it because it's a horrible topic. You can make a big difference in the life of a child by learning about this. So this is kind of the times and the schedules and some of the places where this stuff is at, and we'll talk about this in more detail. Hopefully you do have phone numbers for your clinical instructors, and for me, if you need anything, I would highly suggest putting those in your phone just in case you have an emergency while you're driving to clinicals in the morning or something happens. That way you can contact those people that you need to. You will not have any observational experiences for this except for, SIM and the Health Connect Fair and the abuse conference, but you're going to be, I wouldn't say that those are observational. The other big thing with pediatrics in their clinical setting, I want to go through some of the different assignments and talk about that because you're jumping into clinicals right away. So if you have questions on the schedule, please let me know. I think it's straightforward, but not everybody does. So if you have questions, please ask. So some other things. So underneath resources, there's lots of different tabs that are great resources for you. Some of the big things would be the Child Abuse Conference. And so as we pull that up, this is what it is. This is how to sign up for it. You sign up, you register, you get a ticket. You have to do this individually, get the student rate. It's a lot cheaper. And this will give you access to both days, meals, some snacks, and it will give you access to, you should get CEUs off of it, and you can reference this in the future. So this is the one that you want to register for. I realize that $75 is a little steep. It's a little bit higher than I was hoping that they would have done, but this is still a student rate, and it's better than what other people pay. If you have any issues with this, please talk to me, talk to Dr. Schrendiger. We can help you out with this. This is a financial burden for you. So, but this is where this is where you're going to see this. So it's held in Sioux Falls. It's going to be at the conference. I'm trying to remember where it's at. Sorry, it's Sioux Falls Convention Center. I was trying to think of the name of it. So, but register for it. The nice thing about this is that you're going to see lots of different people there. So you're going to see lawyers there, you're going to see officers, you're going to see FBI agents there, you're going to be seeing social workers and nurses. Dental providers is a big push lately. So you'll see lots of different people that attend this. So it is at Sioux Falls Convention Center. Here's a map if you don't know where that's at. But yeah, so register for this. I will have you check in with me when you get there and then before you leave on each day. And that will kind of cover that. Clinical form, service learning form. I think that you've seen this before. So with that one, it's straightforward. It's you volunteer. I want 1 hour for this clinical course. And you just have somebody sign it, give us a quick reflection on it. It shouldn't be anything major. So this is not watching your sister's kids or babysitting your own kids because that's not babysitting. Um, but you could do a wide variety of different things for this, including if you wanted to volunteer extra for the Health Connect Fair, that would be a possibility as well. So if you have any questions about what it means to volunteer, come talk to me. I can give you some great ideas and some suggestions. The next section I want to cover is the Health Connect Fair. And as we bring that up, it prompts you to a Word document. And within this Word document, you can see that, here is a link to what the Health Career Fair is. And so if you want some more information on it, looking at some pictures from previous years, what Health Connect all does. But basically, this is an annual event that's been going on for decades now for patients and families to learn about health and safety. This was kind of geared towards children at one point in time, but this is expanded into elderly, and it's got everything from immunizations to, don't thump your melon, bike helmets, to bike safety, to a wide variety of different topics and vendors. So you will be at this Health Connect Fair and you'll be presenting at this Health Connect Fair. So I want you to dress up. You'll be wearing your scrubs and dress in an appropriate manner. And you will develop a topic of which you get to choose, kind of. So if you click on this link here, it'll take you to a Google document. These are the things that we've signed up for. You put your name down when one of these groups. So to talk about bullying, energy drinks, healthy eating, et cetera, et cetera, et cetera, et cetera. And then you will develop this. As part of developing this, you will talk to Fran Rice. She is the director of Health Connect, and she's got different resources for you, different poster boards, different games, different clackers, different ways to draw people in, and talk about things that way. So you and your group will do this. Part of your time will be spent in the booth presenting. You get credit hours and clinical hours for setting this up, developing it, meeting with Fran Rice, and of course presenting that day. It goes from 11 till 3. I say 10 to 4. That way you are there it counts for cleanup and tear down, and those kind of things. So, so what I want you to do is when you're preparing for this, think about those things. So you're going to get a table, and how can you present the material that you want to present? So you've got your topic. I'll have you develop it and then present it that day. Do you want to give stickers out? Do you want to give candy out? Candy might not be the best thing at a Health Connect fair because, if you're talking about healthy eating and then you're giving out candy, that can be some mixed messages. So how are you going to draw people in? How are you going to make your talks interesting? How are you going to present that information? How are you going to vary that information from small kids to elderly? But you've got a wide variety of different topics there, so you can select from, but you will develop this on your own. You are all smart, you're all talented, and I want you to do this and develop this. So, like I said, along with that, contact Fran Rice and you'll go to Health Connect, and she's got some different materials that you can select from. Also with this, part of your time will be spent volunteering at the event. So the link for volunteers is right here. So work it out with your group, who's going to work the first half in the booth and who's going to volunteer, and then, halfway through you guys switch. So, if you're presenting for the first 2 hours at the booth, and then you volunteer for the next 2 hours. That keeps the booth sizes down a little bit, and also provides staffing for the Health Connect Fair. So, and that can be a wide variety of different things for your volunteering time, but that's an important component of this. Also, when you're at the Health Connect Fair, I do want you to walk around, take a look at the different booths, look at how other groups are talking to people. How are they pulling them in? What kind of information are they doing? Are they giving handouts? Are they giving stickers? Are they giving, do they have big poster boards? Do they have things screening on tablets? Um, but it is a way for you to learn how to do health fairs and present that information. Because as nurses, you're not just one-on-one caring for people, you're caring for a community and you want to do some education. So you'll have vendor status. So as that, you will all receive a t-shirt, you'll receive a meal. The meal will be something simple, but you will be fed. So it is a pretty laid back event. Um, but if you have questions, feel free and contact me. Students have learned a lot from this. Even though it's pretty laid back, you learn about connecting with that community. So you can tie your community health nursing into this and apply it. So other things, so as we're talking about parking, so Sanford's got specific parking. Um, you can do W, H, or Y, so on the north of the campus, just north of the Vandermark building, or way on the east side of campus. So you'll be here for your rotation at the Children's Hospital. Some people do park on the streets. Be aware that there's some places are only 2-hour parking, some is no parking, some students have gotten caught if there's a snowstorm because there's snow removal, then you got to move your cars. So while I realize that these are, kind of far away, and they are, um, if you park on the streets, there are some things that you need to be aware of and make sure that, you can move your vehicles, or if there's any chance of snow, don't get caught out there because they'll take it in tow. So, something new that Sanford's kind of implemented, I'll let you look through this on your own, but it's the role of the student, nursing instructor, and nurse within the different floors. So this is your instructor's role, this is your role, this is the staff role. So make sure you review this and see what you do and what you can't do. Some of the big things, you can administer meds under direct supervision. In Sioux Falls region, you cannot do any Foleys. So look and see what meds you can do, what skills you may not do. Also, in addition, we are guests in their facilities. So uh, as uh, as guests, maybe it's not a good situation. Maybe they won't let you do an IV, even though you feel comfortable doing it, because it's a 2-year-old child that's got a little chub on them. It's hard to see the vein, and they're dehydrated, and so it would not be the best experience. Conversely, I've had some teenagers that wanted to have students do it because they're into learning. Um, And so it's going to be up to your clinical instructor, your nurse, and you as to, what experiences you can do and what you cannot do. So you cannot do Foley catheters, central lines. So you can kind of see all these things. So read through these, make sure that you understand what you can and cannot do in the clinical setting. Use of the role of the nurses is the role of your instructor. So if you're curious about what they're doing to help you out, that's there as well. So as far as charting, these are the things you can do, cannot do. So this gives you a good indication for if you're at Sanford, the things that you can and cannot do. Other things for clinicals. Sim prep is here. Make sure you do this prior to sim. You do get credit for the hours that you'll work on this, and it will help you out throughout the simulation. Um, if you're worried about being mundane and having it all figured out, don't worry. I can keep simulation interesting for you. Most students have really appreciated these sims, and I hope that you have a good time with them too. You are not graded on the sim prep, and you're not graded on the sim in and of itself. As long as you are doing what you're supposed to be doing and trying, that's really what's important to me. So we'll use it as teaching moments, just as we've done in previous simulations. I think that kind of covers a lot of the clinical stuff in regards to resources on coursework. Some of the main coursework that you'll have regarding your clinicals. You have to have all your Castle Branch stuff in, clinical orientation done. Those are soft chalk modules and uploads. Um, let's see here. Concept maps, you've done concept maps before. You start with the main thing and then you kind of branch out from there. Within these concept maps, you have a good description of them within the assignment, as well as they should have some. If you look on the instructions in some of the files, I've uploaded some of the examples for you. These are, not the way you have to do them, but just the way some people have done them. Some people have used computer printouts and have done it this way and put it into this type of a format. It looks nice. Some people like the organization of it. I will honestly say that I prefer a different method, and the rationale is I think that you get more details out of this, and it is more user friendly. So, um, so I highly recommend writing it out with pencil, like this person did, and then have your main diagnosis here. You've got all your different things that you need in here. So risk factors, assessment findings, labs, nursing diagnosis, outcomes, medications, and connect them. The main thing you've done patho flow charts before, and it's like that, but this is gonna be a little bit messier because not only are you going like in the middle and working your way out in a circle, and you've done all that for med surg, you really need to connect it more. So with some of the stuff, you're seeing connections here between, okay, so what are their vital signs? And why are you going to connect that to this? Oh, they've got this temp and you're monitoring your temp. Why are you checking for temp? Well, because you're worried about infection, and the infection can go with signs and symptoms of infection. So you're connecting all these different things with different lines, trying to see how things are interconnected. It's going to get messy. I'm fine with that. Quite honestly, I can read this pretty well. So if you're looking at failure to thrive, so they're connecting things like, okay, so they're pale, so they're as you're going through this here, you can just follow the different lines and see why they're doing it. Well, they're pale because they've got imbalanced nutrition, they're lacking iron, they're lacking calories. They've got this weird gaze because they don't have enough nutrition. They've got a poor latch, which then of course goes into this. So then you're referring to speech. So all these things will intermix and combine. So for your medications, you should have some sort of link with this for everything. Um, all your interventions should have some kind of link. If your labs are abnormal, or sometimes even if they're normal, they should be linked to something. So go through there and link all this stuff up, um, and make lots of lines and stuff like that. Some people have used like numbers, so they will put their medications down and they'll put a subset by it or a number by it, and then they'll put that number by the different things. So if you've got antibiotics per se, you can put a number by the fever because that could be a thing, or by the wound drainage, or you're linking it to administration and using that as your intervention. Um, so most of these things you're going to have linked in a variety of different ways. But one thing that this will help you with is that if you've got this patient and they've got this and you're giving antibiotics, well, yeah, you're treating it for all the things that you're doing, but are there any side effects that maybe are related to this? So, so upset stomach, diarrhea, any adverse things that people are getting from this, because you have to realize that that's something we need to watch for as well. So, um, so you can look at these for examples. They're not gospel truth. You can take this and do with it as you want, but there are some fun ways to do this. I've actually even met some nurses that they like concept maps so much that this is what they'll use for their reporting and taking notes because they like connecting all the different dots. I don't take it that far personally, but realize that you can. You will have some concept maps that you have to do, so you've got 3 of those, um, and just make sure that you get those done in a timely fashion. These are the things I'm looking for on there. So that you got primary diagnosis, that you got a secondary diagnosis. This might not happen in kids because sometimes they're only in for an appendicitis. Perfect. Just put for your secondary diagnosis, not NA or not applicable. Risk, what was the risk factors for this? Look at your physical signs and symptoms for what was related to your primary. Look at your vital signs. Look at your diagnostic tests that they were doing. Are there CTs? Are there labs? Are there any other ultrasounds? Look at your nursing diagnosis and plans. Look at your treatment and interventions. Put your medications on there. Given in the last 24 hours, look at this and then make sure that you've got all the components of this. Do your continued evaluation. This is very important that you follow up. So if you're given pain medicine, do your continued evaluation saying that 1 hour after pain medicine was given, that pain was decreased, vital signs stabilized, those type of things that you're looking for, saying that what you're doing was effective. Maybe it wasn't. Maybe the pain was higher. Maybe it was worse. Maybe the vital signs are great or increased. But that's something you need to know and deal with. Cultural development, this can be anything. I mean, this could be their religion, this could be their culture, this could be their family life. There's a wide variety of different things to this, but make sure that you are personalizing your patient. They're not just a chart. They're not just, something that you inject meds into. They're a real person, and I want you to treat them that way. So I want you to humanize them and get to know them a little bit. And then you're going to do evidence-based practice. Why are you doing what you're doing? I know it sounds kind of silly and that you've had all this stuff before, but you need to prove to me that what you're doing is what you should be doing. Or conversely, if they're doing something that they don't have evidence-based practice for, why would they do that? Because we do that sometimes, or sometimes we don't have a lot of data to support what we're doing. So those are the concept maps. So 1, 2, and 3, you'll have a discussion after the Health Connect Fair just to see how it went for you, see what you learned, see what you gleaned from there. There's your sim journal. So after simulation, you'll have an upload that you'll talk about simulation, your teaching plan. So this will be graded by your clinical instructor. So while you're on clinicals, you will go into this. Sorry, clicked the wrong thing. But your teaching plan is basically a 3 to 5 minute discussion about some aspect of your patient that you've had. So this could be like albuterol, this could be some of the meds, this could be a procedure that they have done. But pretend like you're teaching the parents and the child the information that they need to know when they get discharged. This is meant to try and get you ready for having patients of your own, and when they go home, what do they need to know? When do they need to call? What are the signs and symptoms they need to watch for? So should have a handout with this. There's a great rubric for this that you can review. So that's found both on this course as well as underneath your clinical course. And your instructors will help you find a topic and stuff like that. But hopefully you find one that's relevant to your patients. Let's see. Family interview and assessment paper. So basically you're interviewing a family. And so as you go into this, there's certain criteria and there's things that I want you to cover. So you're going to cover family structure. You're going to talk about function. You'll talk about developmental stages. You'll talk about family stress. Realize family stage is based on the highest age of the child that they have in that household. So if they've got a 16-year-old and a 9-year-old, go with that 16-year-old age. Family stresses, look at that. Look at the care plan that you want to make for them. And then, of course, there's going to be some APA and some formatting with this, making sure that you've got that it's a nice write-up. So your instructions are here, so they're attached to the assignment. So basically look at that structure, just all those things that we just talked about, structure and function, and what does that all mean? Look at the developmental theory and what stages you're at. So, and talking about the stages here. So these are some of the main goals, and are they achieving that? So if they're, having kids at this age, are they protecting their privacy and safety? Are they socializing their kids? Are they doing these different things? So this breaks it down into all those different age groups and categories. And then you're going to use that ABC X model. So looking at stressors, resources, perception, and then, is this a crisis for them? And if so, how big of a crisis is it? So this lays it out pretty well for you. So you can work in groups, basically split your clinical group in half, and you can work as a group and submit this as a group. So this is a group assignment. The other thing that will be part of that is physical development and assessment. So when you did your write-ups for um, your fundamentals and doing those kind of fun things, that's what this is. But basically, I want you to do it in a child-friendly way within that scope. Your guidelines are attached to the assignment. You cannot put down normal. You cannot put down within defined normal limits because I don't know if you know what that is yet. So you need to write it fully out. You can use medical abbreviation. This does not have to be an APA. Please don't use sentences. Um, but so for like cardiovascular, so pulses are 2+ in all extremities. Regular rate and rhythm for heart. No murmurs, rubs, clicks, gallops. Um, color is good. Perfusion is good, et cetera, et cetera, et cetera. So you do that for each of these sections, and then you look at their development and go off of there. And so look at those different stages and what you might recommend. So you're going to do anticipatory guidance after that. So based on their development, you're going to use this guideline to figure out where they're at. So are they on course? Are they ahead of plan? Or do they have some regression since they're in the hospital, or have they not met their developmental milestones? And off of that, then you'll use those developmental milestones and your assessment of them developmentally to see where they're going, what you should use anticipatory guidance for. We use anticipatory guidance a lot. So if they are starting to roll over, then we're like, okay, they're going to start to crawl. The next stages of that. So we have to really childproof the house, make sure that they can't fall down the stairs, make sure that they can't put anything in outlets, make sure that there's not little pieces for them to choke on. So as they start crawling, then you know that they're going to be walking soon. So then what are the dangers with that? And make sure that they can't reach the stovetops or dump any hot water on them from stovetops or touch hot ovens or anything like that. So we use anticipatory guidance quite a bit. And that's, an aspect of this assignment. So this is for 2 different patients, try and get different developmental stages and 2 different write-ups. And if you have any questions, let me know. This is not APA, this is individual, and it should be just kind of a write-up. Let's see here, Child Abuse Conference. We talked about that. We got exams, MedCalc, all this stuff is for us for class. So if you have any questions regarding this, please contact me. I'm here to help you and support you as you go through this. And just realize that I hope you have a lot of fun. I hope you see the application of PEDS to your career, and I look forward to seeing you in class. So have a great day.